Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for monitoring, evaluating, and applying findings. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. Before starting this series, have you read the Monitoring, Evaluating, and Applying Findings brief and completed the first section of the workbook? If not, we recommend you take some time to complete these steps and then return here to where you left off. Before we begin, we'd like you to take a few minutes to consider your own experience with monitoring, evaluating, and applying findings. Can you think of a time when you had to make informed decisions and guide improvements? What information helped you? How did you get the information you needed? Have you ever had to make decisions about the next steps for a policy or intervention being implemented? How did you know what direction to go in? What information helped you decide? Use your Monitoring, Evaluating, and Applying Findings workbook to write down your answers to these questions. Remember, you can pause this video at any time to record your thoughts and refer to them as you complete all 12 videos in the series. Before digging in, let's check in on a few key milestones teams should have in place as they begin looking at monitoring, evaluating, and applying findings. They should ensure that the team is formed with diverse expertise and representation to guide the change and implementation process. This includes ensuring you have the necessary expertise or support, such as staff or partners. At this point in the work, they need to include new team members or engage with other teams, and the teaming structure is critical. Teams need to include members that are skilled in evaluation, data analysis, and CQI. These skill areas can be added to the team, or the team can develop a process for linking the implementation team with an internal or external partner evaluation team, for example, a university partner. And the team should have a clearly identified problem and an analysis of the root cause or causes of the problem. A theory of change that reflects a clear pathway from the problem to a desired long-term outcome. They've identified, adapted, or designed an appropriate intervention that is well-defined, a good fit, and is feasible within the agency's system. They have readiness assessment findings that include the areas of strength and capacity needs for the selected intervention, and have an implementation plan that incorporates plans to build needed capacities is in place, and approaches for testing, piloting, or staging the intervention have been determined. Taking the time to ensure that these key milestones are in place as teams prepare to monitor, evaluate, and apply their findings over time will increase the likelihood of successful implementation of the intervention. Why should teams invest in monitoring and evaluating their interventions? To find out what is and is not working, what contexts are supporting effectiveness, and also what barriers may be preventing success. To identify strengths and weaknesses of the intervention and the process of implementation to help guide improvements. To help show stakeholder groups, including system partners, staff, and youth or families, what the intervention has achieved and how it benefits the target population. To provide evidence related to effectiveness, being able to show with some level of certainty that the effort has been successful in the agency context. And finally, to contribute to the existing child welfare knowledge base. Teams implement interventions so that they can improve services and outcomes for children, youth, and families, but they monitor and evaluate so they know whether they are doing what they said they would do, and if it's achieving desired outcomes. By assessing how well their interventions achieve desired results, teams can make decisions about what to adjust, continue, expand, or phase out. The concepts of monitoring and evaluation can overlap, but they also differ in various ways. Both use data to inform decision-making and guide improvements. Data that is collected for monitoring a program or practice can be used in evaluation, and data that is collected for the purposes of a more rigorous evaluation can support continuous monitoring. Monitoring is generally an ongoing process for tracking and reporting on program activities and reviewing progress against plans. Monitoring helps teams identify progress or problems and contributes to CQI efforts, for example, using the data collected to make decisions about adjustments. Evaluation is a more rigorous and systematic method for collecting, analyzing, and using data and information over a specified period to answer questions about the effectiveness of a program or process. To sum up, monitoring is ongoing and tends to focus on what is happening, whereas evaluation is a more rigorous process that happens at specific points in time to assess how well it happened and what difference it made. The Monitoring, Evaluating, and Applying Findings brief focuses on two key types of evaluation that are important when trying to gauge effectiveness. Formative evaluation helps teams collect and assess data and information that will guide decisions about improvements to the intervention or the implementation process. Look closely at program functioning. Is the program or intervention working the way it is intended to? And it helps teams to determine whether their expected outputs and short-term outcomes are on track and decide whether to make adjustments. Formative evaluations are especially useful during early implementation, particularly if the intervention is a new design or has been adapted for a new setting or population. Summative evaluation helps teams to collect and assess data and information related to determining the effectiveness of the intervention, program, or practice, and supports decisions about the intervention's effectiveness in achieving the desired outcomes in the agency context. A summative evaluation should be conducted once the intervention is no longer being adapted through formative evaluation findings. A fidelity assessment can also be an essential part of a formative or summative evaluation. Maintaining fidelity to a program's design is important for delivering consistent, quality services in the right amounts and achieving desired outcomes. Fidelity assessments can help teams determine whether staff are delivering the intervention's core components as intended. Fidelity assessments can support staff development, improvement of program implementation systems, and CQI efforts. As part of a formative evaluation, teams can use a fidelity assessment to identify needs to improve implementation through training, coaching, technical assistance, or other supports. A fidelity assessment can also strengthen a summative evaluation and the team's understanding of outcomes. Before making judgments about whether or not an intervention is effective, it's important to determine the extent to which and how well the intervention's core components were implemented. For example, if outcomes are not achieved, fidelity assessments can shed light on whether it was due to the intervention not being implemented as intended, for example, not following the program model or insufficient dosage, or other reasons like a poor theory of change or a shift in the needs of the target population. Formative evaluations and summative evaluations can answer different yet related questions. Let's look at some examples of each. For formative evaluation, some types of questions to consider might include: are staff implementing the intervention and delivering services as intended by the program designers and specified in the intervention model? If not, why? Is the intervention reaching the intended target population? If not, what barriers can be addressed? Are key aspects of the intervention functioning as intended? Are short-term outcomes on track? What has worked well and what not? And what needs to be improved, and how does it need to be improved? For summative evaluation, some of the types of questions to consider might include: what changes in outcomes did the intervention cause or contribute to? Are there different outcomes under different circumstances or for different groups? Under which circumstances and for whom was the intervention most or least effective? Did the intervention have the intended effects on the child welfare system, on the target population? Were there unintended effects on the system or population? And how can the intervention be sustained? A program logic model is a method to visually present the resources the team needs to do the intervention, the planned activities, and the desired short-term and long-term outcomes. A logic model can help implementation teams, stakeholders, and evaluators create a shared understanding of the intervention and expected outcomes. It also creates a framework for monitoring and evaluation. Logic models are related to, but different from, a theory of change. A theory of change illustrates the pathway from an identified problem or need to a long-term outcome, in which the problem has been addressed, and helps explain how and why the change will happen. Teams should have developed a theory of change early in their change process. Many teams find it useful to use a theory of change before an intervention is selected to support selection of the right program or strategy, and a logic model after the intervention has been selected to guide implementation and evaluation. Logic models may take different forms, but often are presented in a linear format as a series of columns. Logic models provide a systematic way to consider each part of a change effort in the big picture. Things like inputs, activities, outputs, and short-term, intermediate, and long-term outcomes. Teams are encouraged to begin planning for monitoring and evaluation efforts early, and to begin considering their monitoring and evaluation needs while they develop a theory of change and then select, adapt, or design an intervention. It's important that these activities become an integral part of the change process so that desired information and data can be documented and early analyses can inform mid-course corrections. Monitoring and evaluation plans may evolve and solidify over time as teams complete implementation plans and think critically about what they want to know. They will both inform and be informed by intervention testing, piloting, and staging activities. Teaming for evaluation planning and implementation is also essential to successful efforts. Groups that teams should include in this work are individuals with evaluation, CQI, and data expertise, program staff that manage and deliver services, partner systems, for example, the courts and community organizations involved in the intervention, service recipients like youth, parents, resource families, or community members, funders, policymakers, and decision makers, as well as program developers. Levels of participation and roles may differ depending on the evaluation's purpose and agency context. Working with multiple stakeholders may require time and resources to develop relationships and build shared understanding of evaluation concepts, tools, and requirements, but can yield powerful results. The Monitoring, Evaluating, and Applying Findings Brief is broken down into 4 parts and 11 essential functions or tasks. It's important to remember that while the steps are presented in a linear way, in practice, often steps will overlap and be revisited as teams continue to monitor, evaluate, and apply their findings over time. As with all phases of the change and implementation process, preparation and planning lay the foundation for subsequent activities. Part 1 of the Monitoring, Evaluating, and Applying Findings Brief is setting the stage for monitoring and evaluation, which includes 5 interrelated functions. Consider the circumstances and needs of the agency, develop a logic model, identify questions, identify measures, data sources, and potential data collection methods, and develop an evaluation plan, including the study design. Given that monitoring and evaluation are dynamic processes that may evolve throughout a change and implementation initiative, these tasks may be revisited over time. Part 2 is collect and analyze data. And it includes strategies to put the evaluation plan into place by collecting and analyzing the data outlined in the team's plan. And then 2 special featured topics that are a version of data collection and analysis. They are examining fidelity and analyzing costs. Part 3 outlines how to use the data collected to make decisions and adjustments, with 2 functions on sharing findings and recommendations, and then making decisions to further spread, adjust, or discontinue. And then part 4 is on sustainability planning and how teams should refine and implement a plan to sustain interventions when this is the decision of the team and stakeholder groups. Let's recap what you've learned about the key phases and essential functions in the monitoring, evaluating, and applying findings brief. Why should teams consider monitoring and evaluation? They monitor and evaluate so they know whether they are implementing the way they intended to, and if it's achieving desired outcomes. Why should teams use a logic model to support evaluation? A logic model can help implementation teams, stakeholders, and evaluators create a shared understanding of the intervention and expected outcomes. It also creates a framework for monitoring and evaluation. When should teams begin planning for monitoring and evaluation? Teams are encouraged to begin planning while they develop a theory of change and select, adapt, or design an intervention. Up next is a more in-depth look at consider the circumstances and needs of the agency, the first function in part 1 of the Setting the Stage for Monitoring and Evaluation.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.